Hi, my name is Sudhir Vashist. I'm a pediatric cardiologist and pediatric cardiac electrophysiologist here at University of Maryland Children's Heart Program. I started as a general pediatrician. I had a short career spanning 6 years as a general pediatrician, and simply because I love kids. Then I decided on to doing pediatric cardiology because I felt this was one of the most fascinating subspecialties in pediatrics, and plus it's also very rewarding. You take care of sick kids and you treat them, and they recover and go home. When I was doing pediatric cardiology, what I felt was within pediatric cardiology, most challenging was electrophysiology. This is something that I realized that even most seasoned cardiologists sometimes would be afraid of taking care of kids with rhythm abnormalities, and I didn't want to deal with that fear for the rest of my life. I wanted to face, I want to face this challenge, and decided on to doing pediatric electrophysiology. It's one of the most rewarding feelings, I must admit. It is intimidating because sometimes the kind of problems you deal with are very serious and life-threatening. At the same time, because you can fix these problems, take care of them, help them live normal lives, it's incredibly rewarding feeling. Actually, my being a pediatrician in the past helps me in that as well. And I thought I was a better pediatrician once I had my kids of my own. So yes, certainly I try to put myself in my parents of my patient's shoes to see what I would like to convey to them so that they feel comfortable handing over their kids' care in my hands. And I think from their perspective, involve them in the decision-making process and empower them so that they feel at home. Pediatric electrophysiology is diagnosing and treating children with heart rhythm abnormalities. These heart rhythm abnormalities could be fast heartbeats, could be slow heartbeats, or some electrical abnormality of the heart. The diagnosis part of it could be as simple as performing some non-invasive tests such as EKG, a Holter monitor, or an event monitor. Basically, we look at the snapshot of the rhythm abnormality and look at those tracings and diagnose a problem. Sometimes it is more complex or complicated than that. In those situations, we have to perform special diagnostic procedures, invasive procedures, same-day procedure when they come to the lab. We have catheters in the heart and stimulate the heart with electricity, see the flow of the electricity in the heart, and try to induce those rhythms and make a diagnosis. Once we have made a diagnosis, then we make a determination whether we need to do something about it or not. That could be either getting rid of it by doing a catheter ablation procedure, and we use typically two forms of energy to do that. One is radiofrequency energy or heating the tissue, or sometimes we just freeze the tissue with cryoablation. Sometimes these problems are not fixable in the lab by ablation. In those situations, we recommend and perform a pacemaker implantation, which is basically supporting the heart with rhythm issues, and also in some situations a defibrillator which can shock you out of the bad rhythm. I can say it with great confidence that our cardiology team here at University of Maryland Children's Heart Program can provide comprehensive, state-of-the-art, most advanced cardiac care to all the kids in the state of Maryland with any kind of cardiac care or help they need. And we do have a comprehensive division which basically spans all the subspecialties of pediatric cardiology that you can imagine, right from interventional cardiologists to imaging cardiologists to electrophysiologists. And we are recently blessed with having an excellent pediatric cardiac surgeon. So with having all the nuts and bolts in place, I can assure that we can provide most comprehensive and state-of-the-art care to kids in state of Maryland.